unmute and I will turn the recording on. Thank you very much for that. And give me 1 second. I need to let some people in from the waiting room as well. So thank you all for joining us this morning. I really appreciate your time. I recognize that it is a very busy time of year. And so I'm grateful for you setting aside 45 minutes or so to get some information about a fairly new law in the state of Nevada that will help unaccompanied youth under 18 access certain kinds of medical care. So let's just jump right in. For those of you who might not be familiar with Schoolhouse Connection, we're a national nonprofit organization working to overcome homelessness through education. And part of what we do at Schoolhouse Connection is state policy advocacy. And so that is primarily what brings me to you today. We were able to partner with a number of organizations in the state of Nevada, most particularly the Nevada Partnership for Homeless Youth, which is in Clark County. Some of you may have worked with them before, to actually help to make some changes to the state law regarding medical care access for unaccompanied youth. So that's what we're going to provide you with some information about today. I would like to encourage you all to ask any questions you have. So feel free at any time to type questions into the chat. Also, just feel free to unmute yourself. You are welcome to interrupt me at any time throughout the presentation. I will be stopping for questions as well, but please feel free to jump in at any time. The most important thing that we can do today, I think, is to make sure that your questions get answered and that you get the information that you need. So please do feel free to jump in at any time with any questions. What we are going to talk about today is AB 197. I'm going to give you the real nuts and bolts of the law. I've got actual quotations from the law so that you'll really be getting the exact information. I want to let you know what services unaccompanied youth can consent for, what's the role of the school, because I'm guessing that most of you are either school nurses or school social workers or McKinney-Vento liaisons or otherwise involved in schools and school districts in Nevada. And then I want to provide you with some resources. So I will be able to give you the link to the actual text of the law so you can read the law yourself, some additional resources. And what I will do is after the presentation today, I will send you all a copy of this PowerPoint. So don't worry about scribbling down links or anything like that. I'll send you the PowerPoints that you can access it yourselves directly, and you can just click on those links directly. And I'll also send you a copy of the recording so that you can listen to it again, or you can just forward that to colleagues who you think might be interested. So rest assured that I will make sure you get those materials. If not today, then certainly by tomorrow. Sometimes it takes a little time for the recording to process. So maybe tomorrow, but I will definitely get you that information. So what did AB 197 do? This law was passed last year, signed by the governor actually at the end of May of 2021, so almost exactly a year ago. And it amended an existing state law. So there is a NRS, which stands for Nevada Revised Statutes, section, that little squiggly means section 129.030. This law has actually been on the books in Nevada for many, many years. And actually unaccompanied youth were given the rights to consent for medical care in Nevada way back in 1975. So this is not anything new. What is new is some changes that were made to the law, and that's what I really want to share with you all today. So for some of you, this might be brand new information. Others of you might be familiar with NRS 129.030 from before, but I just want to make sure that you know what the new rules are. So if we go all the way back to 1975 and we look at Nevada statutes from 1975, this is how it used to look, however many years ago that is now, almost 50 years ago, 45 years ago. This is not the way it looks, although it looks very, very similar now, but there have been some changes. But I just wanted you to see that this has been in place for a very long time. And so what we'll be talking about now is just some of the changes that we have made there. So I'm going to go through this piece by piece to try to make it really clear for you, because I know sometimes these laws can be confusing to follow. So I want to start with the sort of the who, what, when, how, where's, those questions. So first of all, who can consent? This law specifically applies to minors. So that's a person under 18 years old. Once somebody turns 18, then they're an adult and they can consent for medical treatment as any adult could. So that is already going to be their right. So this is really applying to youth who are under age 18. And typically they would need a parent to be able to access medical care. But what this law says is that a youth who is under 18, who is living apart from a parent or guardian, and with or without the consent of the parent or guardian. So again, you don't need to know, and a medical provider doesn't even need to know. Do your parents know where you are? Did they say that it was okay for you to leave home? It doesn't matter if the youth has the consent of the parents or legal guardian or not. The question is just, are they living apart from their parent or legal guardian? And that's what the law says, period. There are no other qualifications on that at all. There are also a bunch of other categories that you might want to know for various reasons. So if you're working with youth who are married, who have had a child, who are at risk if it's an emergency and they need emergent medical care because they're in danger of some kind of a serious health consequence, they would also be able to consent. Also, youth who are in protective custody or who have been emancipated are also able to consent. But I really want to focus on that number one, because we're really here to talk about unaccompanied homeless youth today. So that's where my focus is going to be. But I did want to let you know that there are other categories of young people as well who are covered by this particular law. So how does a healthcare know that a youth is living apart from a parent or guardian? Because any youth can walk into a doctor's office, right, and say, oh yeah, I'm not living with my parent and I want to consent for XYZ treatment. And a healthcare provider might be uncomfortable with that. I mean, they might not. They might say, okay, great, we believe you, or I know you, or I've seen you around before, or you've been my patient for a while, I've got this information. Or the provider might just ask the youth a couple of follow-up questions, and that might be enough information for the healthcare provider, and that's just fine. So the youth does not have to provide anything in writing. There's nothing in the law that would require the youth to provide something in writing. If the healthcare provider is comfortable providing the treatment, that's great. They don't need anything else. But the law does provide for a little bit of documentation, just recognizing that a lot of healthcare providers might not be comfortable providing that treatment. They might want some more information so that they really feel like, okay, this youth is in fact living apart from a parent or guardian. So what the law says is the youth may provide a written statement that affirms, that documents that youth is in fact living separately from a parent or legal guardian. And that written statement, there's nothing in particular that the statement has to provide other than saying, yes, I know this young person and they're not living with their parent or guardian. And it should be signed by one of these three folks that are listed on this slide. So for those of you who are with schools, I direct your attention to number 2 there, a school social worker, a school counselor, or your McKinney-Vento liaison can sign that letter. Now, I want to make it clear, this letter is not a medical document. You're not saying, yes, this youth needs treatment for pink eye, or yes, this youth needs an antibiotic for an infection. The school staff signing this letter, they are not the medical professionals. All this letter says is this youth is living separately from a parent or guardian. It's up to the healthcare provider to make decisions about what's appropriate healthcare for the youth to receive, and the youth can consent or not consent for that healthcare. So that's really going to be between the youth and whoever the healthcare provider is. This letter is not about that. This letter is just about the fact that the youth is living separately from parents or guardians. And you can see that the letter also can be signed by a shelter provider or another service provider who works for a nonprofit or a government agency that's providing services to the youth. It also can be from an attorney who might be representing that youth on any of a variety of legal issues. It might be about a domestic violence issue, it might be about an immigration issue, whatever that attorney might be doing for the youth. So those are the different categories of people who can provide that written statement that the youth can then take to the nurse, the doctor, the nurse practitioner, whoever that provider might be, and say, here's my written statement that just sort of affirms that I am living separately from a parent or guardian. And again, that statement is not a legal requirement, but it is, I think, a really helpful tool for healthcare providers and for youth to have. So that's sort of the who can consent. If you have any questions, again, about any of this, please feel free to type questions into the chat at any time as I'm going through this. Also, just unmute yourself and jump right in and interrupt me at any time as well. I invite you to do that. But let me tell you now, for what treatment can the youth consent? And this is really broad, and I have provided, again, quotations from the law so that you can see exactly what it says. It says physical, behavioral, dental, or mental health services. The youth has to be able to understand the service, which, you know, most of your young people, the healthcare provider is going to explain to the youth what this means. You know, we would like to provide you with an antibiotic because you have an infection in your tooth and you need that to cure the infection. That's pretty basic information that youth are going to be able to understand. So the medical provider is going to explain that, I think, in a way that youth are going to be able to understand. So unless it's some very, very complex kind of physical condition, hopefully the youth would understand the nature and purpose of that treatment and that examination. And of course, the youth has to consent. So if the youth says, no, thank you, I don't want your antibiotic for my tooth infection, then, you know, that's really the youth's prerogative to do that. That's what this law is doing, is giving the youth that power to make medical decisions just like an adult would for themselves. So for most of the basic kind of treatment that youth are going to need, again, because they have some kind of infection or a stomach flu or whatever sort of routine medical care they're in need of, that also would include counseling, for example. So we're talking about mental health services. You know, I want to be able to talk to a psychologist about issues that are going on with me, perhaps a psychiatrist, substance abuse treatment that might be considered behavioral care, behavioral health care. So that would count as well. So really all of those kind of different kinds of treatment are included under this statute, and the youth do have the right to consent to those kinds of treatments. I want to point out that specifically exempted in the law is sterilization. I don't think that would come up, but in the case that it does, youth under 18 cannot consent to be sterilized. They cannot consent to an abortion because there are separate laws in Nevada that cover a minor's right to have an abortion. And so this would not create any exceptions to those existing laws around abortion. And also it does not cover DNR or do not resuscitate orders or also advance directives. So again, those are pretty unlikely to come up anyway. So, you know, most of the kind of healthcare that unaccompanied youth might need would be covered by this law. So another question, what providers are covered? You can see on the slide, again, this is exactly from the law. For most of you who might be on this webinar, or you might be referring youth for healthcare, you'd probably be looking at that third bullet or perhaps the fourth. Any licensed provider of healthcare in the state of Nevada is covered by this. So anyone who is a licensed nurse, a licensed clinical social worker, for example, who's maybe providing behavioral health care or mental health care, obviously a physician, a pediatrician, someone who is a licensed drug treatment provider. So any licensed provider of healthcare is covered by this. And that would include, in addition, also any services that would be provided in a public hospital or a private hospital or anything by a board of health. So again, this is pretty broad. Most of the healthcare providers that you would be referring a youth to, providers who are in your school, again, assuming that they're licensed, they're all going to be covered by this bill, or by this law, I should say. Sorry, it's not a bill anymore, it is a law now. So providers can provide this care without parental consent, but do they have to call the parent and just let them know what's going on? No, they do not. They do not have to do that. There's no requirement that they do that. And in fact, it might be a problem for them to do that because the youth might not want their parent contacted, and the youth might actually leave the healthcare provider and not get healthcare that they really need because they don't want their parent contacted. So I put in quotations here again exactly what the law says. So the law does say that the provider should make prudent and reasonable efforts to obtain the consent of the minor to communicate with the parent. So this does not say make prudent and reasonable efforts to contact the parent. That's not what this says. This says, ask the youth, hey, you know, you have this infection or this medical condition. It really might be a good idea for your parent to know about this. Can I contact your parent? And if the youth says no, then no. Then the provider does not contact the parent. If the youth says, yeah, you know, you're right, I'm a little bit scared, I really would like you to contact my parent, then great, then the provider would contact. So again, the youth is in the driver's seat under this law. The law gives the youth the right to make the decision, do I want my parents contacted or not? The healthcare provider needs to raise that issue with the youth and say, hey, would you like me to contact your parents? I think it might be a good idea. But if the youth says no, then the answer is no. And you can see in purple there, the treatment cannot be delayed or denied because the minor says, no, I don't want you to contact my parent about this. So you really are treating this minor really as though they were an adult. They control access to their healthcare information just the way an adult would provide access to that information. So I think that's really important for providers, for healthcare providers to see, and for everyone to know, and for youth to know what their rights are in that legal regard. And for those of you who work with unaccompanied youth every day, you know that there are lots of reasons why youth don't want their parents to have this information. A lot of youth are fleeing abuse. They may have been kicked out of their homes because of pregnancy or because of sexual orientation or gender identity. Their parents might be actually very unsafe people for them, and they don't want their parents to know that they're ill, or even where they are or how they can be found. So that's why this law puts youth in charge of that information and that decision. A lot of people wonder, well, who's going to pay for this? I would suggest that most of your unaccompanied youth are going to be eligible for public health insurance, for Medicaid within your state. And so the treatment is going to be paid for by that health insurance. There's not really an issue there. And that would be really, again, for the healthcare provider and their office staff to do that billing directly to the health insurance, if there is health insurance available. If not, then again, that healthcare provider would follow whatever procedure they would follow for anyone who is an uninsured individual. If the youth actually has private insurance that is provided by their parents, so maybe their parent has insurance through their work or through some other kind of health insurance program, again, the insurance is probably going to pay that directly anyway. But if there's some kind of a copay or some kind of actual financial liability related to the service, the parent is not going to be liable to pay for that unless the parent has consented. So again, I would say your healthcare provider typically is going to go through whatever insurance provider might be available, and they're probably going to get that payment through insurance, whether it be public or private. If not, they're going to follow whatever procedures they would follow for someone who's uninsured if the youth doesn't have insurance. But if there are any payments that need to be made that a parent typically would be liable for, they actually won't be liable for that in this case unless the parent consented. Now, under Nevada state law, parents are always liable for payment for emergency services, and this law doesn't change that. So if it's an emergency, any youth for any reason, if it's an emergency, healthcare providers are going to address that emergency, consent or no consent. That's really kind of a separate issue, and then they're going to do their billing the way they would normally do it for anyone. It's kind of a separate issue from this particular statute. And then the last thing is just some technical details that sort of go above and beyond basic information, but I thought it was important to share. If later on the youth sort of changes their mind, or if the parent shows up and says, I can't believe that you provide this service to my 17-year-old, I'm going to sue you for doing that, you shouldn't have done that. The law does provide protection for healthcare providers, that if the provider, reasonably believes that this youth is a youth who is living apart from a parent or guardian, and they provide that service, then that provider is not going to be liable for any problems related to that. Now, if the provider was negligent, if the youth said, oh, I'm allergic to penicillin, and the provider says, I'm sure it'll be fine, and gives them penicillin anyway, that's a different issue. There will be potential liability there. But there won't be liability just based on the age of the youth, or that the provider provided those services without parent consent. There is a special protection for healthcare providers for doing that. So they can, at least providers can rest assured that, they can go ahead and treat that patient, that minor child, without having to worry about someone coming back later and saying, well, no, they didn't really consent. They weren't 18. You shouldn't have provided that. There's that safety for the providers there. So I do think that's really important. So let me pause for a moment. I know that I haven't been telling you to go ahead and type your questions into the chat or unmute yourself and ask any questions, but I think that was a lot of legal information that I just threw at you. So let me pause and create some space for anybody to ask any questions that you might have so far. Again, whether that be in the chat or just feel free to unmute yourself and chime right in. And I will be quiet for a few minutes and give you that opportunity.
I'm not sure if this was mentioned, but when we're talking about youth, what is the age group that we're looking at as it pertains to this law?
Thank you for asking that, because I should have addressed that and I didn't. So let me go back to who can consent. The law just says a minor. So there is no minimum age in the law. It just says a minor, so that's anybody under 18. Obviously, once they're 18 or over, they can consent as an adult. So it just says a minor who is living apart from a parent or guardian. But what I think I would point to, it's not a specific age range, but I do think it's important is, let's see, the provider does need to make sure that the child understands the nature and purpose of the exam and of the treatment. So at a certain age, you know, a 6-year-old child is really probably not going to be able to understand the nature and purpose of the exam or the probable outcome. So that would really be in the healthcare provider's discretion. And it would vary, of course, depending on what kind of treatment you're providing. You know, pretty young children probably can understand, you know, you have an infection, I'm giving you an antibiotic. But that would be up to the healthcare provider to talk to that youth and sort of make that determination of, yes, I do think this youth can understand what we're talking about and can understand the treatment that I'm proposing and make informed consent for that treatment.
So one other question, since the age range is just under 18, at what point does a medical provider, like where does this intersect with child protection laws? So like, let's say that you get a 9-year-old that is unaccompanied on, you know, and comes in for medical care, you know, at what age, you know, do we consider that a youth might not be self-sufficient, not being accompanied by a parent or guardian?
That's another great question. So being a mandated reporter, of course, what you're looking at would be abuse or neglect. And so I think that there are probably a variety of factors that a provider is going to want to consider after talking with the child or youth. Certainly age is absolutely one of those factors. There might be other issues that you want to talk to about the youth. I mean, some kids might be coming into the doctor alone because their parent is working and couldn't get there with them. I mean, there might be a variety of reasons why this happens. That's not going to be the most common reason. Obviously, most commonly, it's going to be that the youth doesn't have anybody, or their parent is just not around and not taking care of them. And so I think you might want to ask questions about, well, who are you staying with? Are you staying with somebody? Do you have a safe place to stay? What's going on with your parent? You know, you don't want to give a child a third degree, because on the one hand, you really want to make sure that they get the healthcare services that they need. And asking a lot of questions might scare them away and just make them leave without that antibiotic or that service that they really need for their health. So I think it's very complicated to find the right balance between providing the care that the youth needs, while also, you know, recognizing that you may, in some cases, need to make a child protective services report. If there are other people in whether it's the medical office or the clinic or the hospital or whatever it is, if there are social workers or others who might maybe be the right person to sit down and have a conversation with that youth that's separate from the actual healthcare being provided, that might be a good strategy. You do need to keep the healthcare information private. So that's why I pulled up this slide again about contacting parents. But I mean, I do think that there will be cases where the healthcare providers will feel like, you know, this feels like abuse or this feels like neglect, that I do need to make a contact because this child's in danger. You know, they don't have any place to stay. We don't know where they're staying. We don't know who they're staying with. It may be that they're living apart from their parents, but they're staying with a grandparent or an aunt or uncle, or a situation that really does feel pretty safe and pretty stable. And, you know, the provider might decide, I don't need to make a CPS call on this. So, you know, I can't really give you legal advice about when to make that call or when not to. I would just say, you know, case by case, try to get some help to have a conversation with the youth, and try to, you know, make those decisions together with the youth to the maximum extent that you can.
Thank you.
Thank you for those questions. And I'd love to hear if anybody else on the call wants to chime in on any of those questions. I know a lot of you on this call have a lot of experience working with unaccompanied youth. So please feel free to chime in and share your thoughts and expertise too. Okay, well, thanks for those questions. I'll move on, and we'll have another opportunity for questions in just a few minutes. I want to make sure that we make good use of your time and get you out of here on time today. So a little bit about the school's role. Well, for those of you who are healthcare providers in a school setting, like I said, school-based providers who are licensed are covered by this law. So you can examine unaccompanied youth, you can provide them with treatment. For unaccompanied youth who typically don't have transportation, those school-based healthcare services are critical for them. The school nurse is, one of the most important people oftentimes in an unaccompanied youth's life because they don't have any other way to access basic healthcare. So being able to access school-based healthcare providers, mental health care providers that are school-based, that's really critical. And so for those of you who are in that position, I just thank you for the work that you do, and want to make sure that you recognize how valuable you are, not only to all of your students, but to unaccompanied youth in particular. Another thing that schools can do, of course, is provide that written document that I mentioned, provide youth with that letter saying, yes, this youth is living apart from parents and legal guardians. We've created a sample letter for you. Again, when you get this presentation, you'll be able to just click on that link and it'll take you right to the sample letter. It's a Word document. You can download it, you can edit it, you can put your letterhead on it, and you can use that to give that letter to unaccompanied youth so that then they can take that to whatever healthcare provider they might be seeing. For those of you who are familiar with providing letters for financial aid for the FAFSA for youth, it's a very similar thing. It's not talking about what kind of healthcare the youth needs, or it's not providing consent for healthcare. All it is just verifying the fact that this youth is living separately from a parent or guardian. So again, you'll be able to download that sample when you get the link. I also wanted to just really call attention to the disproportionate incidence of homelessness. We know that homelessness does not affect all youth the same way. So we know that youth of color are much more likely to experience homelessness than white youth are. We know that LGBTQ students are more likely to experience homelessness, and in particular, transgender students are almost 10 times more likely to experience homelessness. And we also know that youth who are pregnant or who have gotten someone pregnant are 10 times more likely to experience homelessness. So, there might be different healthcare consequences and healthcare challenges that different populations are more likely to face. We know that from public health research and from other information. So a lot of the youth who are most likely to experience homelessness also are most likely to have healthcare needs. So making sure that we're doing outreach to those populations really specifically and in a really targeted way to make sure that they know what their rights are, that they get that letter verifying that they're unaccompanied youth, so that they can access services that they might need, whether those be mental health services, physical health, prenatal care, et cetera. It's just really important that we're doing that deliberate outreach to those populations. So a couple of ideas for you of different things that you might want to try to do. Get the word out. This is, like I said, it's a relatively new change to the law. Even though the law has been in place for almost 50 years, these changes are new, and it takes a while for this information to filter down to people who need it. So please try to share this information. Get the word out to youth. Again, particularly looking at your youth of color, your LGBTQ plus youth, and pregnant or parenting youth. Put it out on social media, on your school district social media, on your school building social media. Put it around your school building. Put a little poster on the back of the bathroom door. Put table tents in the cafeteria. Just get the information out to youth who, otherwise, they're unlikely to know that this law exists unless they're hearing about it from service providers or schools. And get youth to help you. Ask young people to put it out on their own social media, do a TikTok about it, whatever they can do. Young people are really the experts at getting the word out to each other and to their peers. And you can provide a youth with a stipend to say, hey, we want to make sure that our students know that they can access healthcare, mental health care, behavioral health care. Will you help us get the word out? Will you come up with a social media campaign for us, or design a poster for us, or tell us where to hang the posters, or hang the posters for us, that you can actually hire youth to help you do that. Also, get the word out to professionals. Tell your peers, tell your colleagues, tell your fellow nurses, your fellow pediatricians, your fellow liaisons, school social workers, spread the word. Like I said, I'm going to send this PowerPoint presentation and this recording to you. You're welcome to forward that near and far. You're welcome to put it up on your school district website if you want to. We're not using this as our own property at Schoolhouse Connection. We just want to get the word out. So you can share that far and wide. Ask colleagues at the state level, who might work with school nurses or might work with school counselors. Hey, do you want to send this out to your mailing list? You're welcome to just send it everywhere. And make sure that the people get all the information. I think sometimes people hear just part of it and they get misinformation that way. So we want to make sure people understand everything that the law provides, but also what the limits are to the law as well. So like I said, you're welcome to just send this PowerPoint to anyone who you think might be interested in it. And I'd also like to ask for your help in spreading the word. In the beginning of August, on Thursday, August 4th, together with partners at the Nevada Partnership for Homeless Youth and Legal Aid of Southern Nevada, we're going to be doing a brown bag lunch specifically for healthcare providers. So it's open to everyone. So again, please, you're welcome to share this with colleagues at school. Anybody can come, but the target audience really is behavioral health providers, mental health providers, nurses, pediatricians, doctors, nurse practitioners, every healthcare provider. We're going to have a healthcare provider speak. We're going to have a youth speak about their experiences. So I think it's going to be a pretty fun and interesting hour or so over lunch on Thursday, August 4th. The link is on the slide. Again, you'll get that link when you get the PowerPoint presentation. So I would love for you to send this out. You can take a screenshot of this slide if you want to, and just send the screenshot out. We're hoping to have as many people as possible so that we can just, again, spread the word about this law in Nevada. So let me pause again for any questions that anyone has. If anyone has comments, I'd love to hear it. If you've worked with an unaccompanied youth who's been able to get some healthcare attention since this law's passed, and you want to share what your experience was what that was like, I'd love to hear your experiences. Even if they were positive or negative, if you've encountered some barriers, I'd love to hear what the barriers were as well. So let me again create a little bit of silence and a little space here for any questions that you might have. And while you're thinking of your questions, I'm going to go ahead and get the link for this PowerPoint and put it in the chat right away. Okay, I did put the link for the PowerPoint presentation in the chat. You can click on that right now if you want to and go ahead. You should have no problem accessing it. Like I said, I will send it out to everyone along with the recording of this webinar probably tomorrow. So you'll go ahead and you'll get that in your email as well, so you can forward it easily from your email. Any other questions or comments or anything that anyone would like to share related to the information? I know it was a lot of information that I shared very quickly, so I'm happy to address any questions that you might have.
Patricia, I just tried to access the PowerPoint, but it says that I need to get access permission from you. Did I do something wrong?
No, let me check. Maybe I did. I had it open, but I think when Lacan, who is our communications expert, edited it for me, I think he may have changed the permissions. So let me go ahead and update those permissions.
Okay, thank you.
No, thank you for raising it. So I updated the permissions, so you should be able to access it now. Thanks for letting me know about that. Yeah, okay, perfect. I can see people accessing it now. So I guess I did that right. So what you have, if you want to scroll down to the last slide, if you want to get on it, and I'll share my screen as well so that you can see it on my screen. Here we go. I'll just show you this slide. These are all hot links. So you can access the actual bill number, AB 197. You can see the changes that were made. You can also access the Nevada revised statute So that might be a good thing even for a youth to have in their back pocket when they go to a doctor or a medical professional, and that person might not know about the law. Sometimes it's helpful for the youth to be able to say, well, here, they can pull it up right on their phone even, and they can say, well, here's 129.030, you know, in case you wanted to see it. Again, there's the sample written statement for schools, just a sample letter you can download, put on your letterhead and give to youth. That link for that August 4th brown bag lunch that I mentioned, and then just a couple of other links in my contact information. If you have any follow-up questions, you're welcome to email me at any time. I do see one question that came in the chat. How do we expand this access to all adolescents? And that's, you know, that's a good question. That's really kind of a policy question around, you know, what do we feel like youth's rights should be, and what do we feel like parental rights should be? So I would almost kind of defer that to your state legislature about, you know, where do youth's rights begin and parents' rights end? You know, I'm a children's rights attorney, so my orientation is very much give youth rights, but that's just my opinion. And others probably have very different opinions from that. So what we have right now is really looking at, if the youth is living with their parents, then their parents would have those rights around medical care for the youth. And if they're living apart from their parents, then the youth get those rights. That's the policy balance that the Nevada state legislature has struck. And if people have different opinions about that, then I would definitely say, absolutely get in touch with your legislator and tell them what you think, and encourage them to, you know, to take action that aligns with your views. That's their job. They represent you. All right, well, seeing that I'm not hearing or seeing any additional questions, I really appreciate your time again. I really appreciate you being here with us for this conversation. Please feel free to email me anytime if you have other questions that are coming up for you, or if there are other tools or resources that we could provide to help you or to help youth that you're working with. Definitely feel free to let me know that. Ask me for what you need. We're happy to provide it. Oh, I'm sorry, do we have another question?
I do. Hi, my name is John Phoenix. And I work in the HIV prevention space largely. And we're working on, you know, advocating for legislation change around adolescents and being able to access HIV prevention. So if my medical judgment is that this person is at risk of HIV acquisition based on that last slide that you showed, number 4, would that be potential protection for me to offer HIV prevention services for them? So if they're at risk of getting HIV because of sexual behavior or injection behaviors, etc.
So you have to kind of go through the whole statute step by step. So you have to start with the who can consent. So the youth would have to either be 18 already, or they would have to meet one of these other requirements of living apart from a parent or guardian, being married, has born a child. You might, in your judgment, say that they're in danger of suffering a serious health hazard. That usually is more about emergency services, like someone has, you know, some sort of urgent emergent condition that is definitely going to get worse if they are not treated. That's usually what number 4 means. But it does say in the judgment of a healthcare provider, and I'm not a healthcare provider, so my judgment really doesn't count here. It really would be the judgment of the healthcare provider. You know, you might want to talk with some colleagues about, you know, what they think their judgment would be, so that you can sort of feel like, does your judgment align with what is typical judgment? Because as a lawyer, what I can say is that if you were to get sued, the question is going to be, was your judgment reasonable or not? That's going to be the legal question. So okay. I don't know if your judgment's reasonable because I'm not a healthcare provider, don't ask me, but you know, if you can find, if every other healthcare provider says, no way, I wouldn't have done what he did, I think that was wrong, then you probably could end up in some legal trouble there. So that's why I suggest talking to colleagues, not that I don't trust your judgment, just, you know, thinking ahead to a potential legal problem.
Okay, awesome. Thank you very much.
Yeah, thank you very much for that question. That's a really important question. I also see that I got a question, would you or someone else who knows the statute well be willing to present to a particular agency at a staff meeting? 100% yes. My most important interest here is to get information out about this to youth and to healthcare providers and to school staff and nonprofit organizations. So absolutely, yes, if you want me or someone else to present about this at one of your staff meetings, just drop me an email. Again, my email is on the last slide. I'll just swing down to the last slide there. Patricia@schoolhouseconnection.org, pretty easy. So just drop me an email and I'll be happy to do that presentation or set you up with someone else to do it. That's a great idea. Thank you for that idea. Okay, I'm doing my teacher pause to see if any other questions or comments come in. I really appreciate all of you who have asked questions. Thank you very much for participating. Okay, and I think so. Okay, so I think we're done then with questions. Again, I want to thank you for your time. I'm really, really grateful. Please, again, feel free to share this far and wide. Feel free to ask me any questions that you have that come up later or invite me to another training. I'll be more than happy to jump in on one of your trainings. But I will go ahead and let you go and get back to your day. And just, again, so grateful for your time. I'm very grateful for all the work that you're doing for unaccompanied youth. And I recognize the value of what you're doing in your time and your energy and your brains. So I appreciate that. And I wish you all a great day. Thank you so much.
Thank you.